Good afternoon, dear colleagues. Welcome to this live session about the EFP Digital Innovation Award. My name is Bruno de Carvalho, and I'll be your host for today's live session. We have an exciting lineup planned. We'll be exploring the remarkable innovations introduced by last year's award winners and getting firsthand insights about their experiences. As we did last year, this live session offers a unique opportunity for you, our audience, to meet the winners and ask any questions you may have about the award itself, the application process, and the types of innovations we are looking for. So please feel free to ask your questions at any time throughout the session. We are live on YouTube, LinkedIn, and Facebook. But of course, to help answer these very specific questions, I'm joined by a key figure in these awards, Andreas Stavropoulos, Chair of the Scientific Affairs Committee of the EFP. Andreas, thank you for being here. How are you today?
I'm very good, Bruno. Thank you very much for this initiative to present to our colleagues this important award. The EFP Digital Innovations Award, this is an award in collaboration with the company Helion. It's on the fourth edition. We have started back in 2022. And it promotes projects that have to do with digital innovation for all health. It has three categories. It has a category that's called public innovation. So digital innovations like apps, for example, that they are promoting our health within the public. Let's say apps to create awareness of gum health in the public, in our patients. Then it has a category that is regarding digital innovations that can be applied by the dentist. Let's say a digital innovation that can assist in diagnosis. And then it has a third category, research innovations. So digital applications or digital tools that can increase and higher the level of dental and periodontal research, of course. The award has also three categories in terms of winners, first, second, and third. And this is connected to a monetary, more or less symbolic award, but mainly what you get from this award is that you get a boost and the exposure in our community.
And what a great way to promote gum health through innovation. So we are going to start with our first winner. Let's start with Zerina. Zerina Hadzik is a specialist in periodontology and oral medicine from Sarajevo, Bosnia and Herzegovina. And Zerina is one of the three winners of the EFP Innovation Award in 2024. And she developed an AI-supported app called Mom Dental, which is designed to provide pregnant women with tools to help them better manage their oral health. Zerina, tell us more about this project.
Yes, thank you, Bruno. And I would like to thank the EFP for having me for this live session on Digital Innovation Awards. Today, I'm presenting my app, which is named Mom Dental. Next slide, please. So Mom Dental is an innovational AI-introduced app, and it is supported with AI in a way to fill the gap between the pregnancy and periodontal health. This app is made to empower the expecting mothers to help them recognize by simply using one effective tool the symptoms of periodontal disease. Next slide, please. So if we look at the data, we can see that many pregnant women are really unaware of the importance the gum health has on the pregnancy and the pregnancy outcomes. And the studies have shown that we have quite big numbers of present symptoms of gingivitis and periodontitis during the pregnancy. So in the next slide, I'm going to show you some presentations of how this app looks at this very moment, because it is still in development, but there some of the elements are already very nicely visible. So next slide, please. So you can see that the app has 5 main points, 5 main components. Those are the daily reminders, the calendars, gum health guide with many useful informations and articles on periodontal health, and also 2 very important components. First one is going to help women track the closest periodontist in case of need with a map that is going to have all the periodontists worldwide included. And the main AA component is really to take the photograph, which is going to analyze the symptoms of periodontal disease. Next slide. So one of the possibilities, as I said, is to track the symptoms, and this is going to allow the users to have a daily up-to-date presentation of their periodontal health, and the symptoms are going to be analyzed by the use of the AI program. So in the next slide, we now have how the AI is going to be used. So it's going to use the photographs of the gums and do the analyzation and trackment of the symptoms. The users are going to get back a report on the status and the symptoms present in the patient. So next slide. In this slide, you can see how the analysis is going to be available and how the users are going to be able to connect them with the alerts and reminders. Next slide. So here you can see that the EI is going to do analysis. After that, we're going to have the trackment of the symptoms. Now, after that, of course, our users are going to be having an available educational content, and they're going to have a possibility to interact with the periodontists. Next slide. So you can see how in the mobile phone is going to look the app for one single users. In this case, you can see the presentation of a screen where the user is going to be having a possibility to export the data and the analysis of the gum status in the form of the PDF document and save it to the phone, to the documents, or maybe even send it directly to the periodontist. So next slide. So in the conclusion, really, I would like to say this app is going to fill the gap in maternal healthcare, because we see we have a lot of symptoms of periodontal disease in pregnant women that are not treated, and the goal is to have healthier pregnancy outcomes, and in conclusion, of course, healthier mothers and healthier children. Next slide. So this is just my personal data. I would like to use this opportunity to call out to the colleague periodontists to send the informations on their offices and clinics, so we can include them, of course, in that important segment of the app, which is the map of periodontists, so the users can easily get to them, contact them, and of course, have a better access to the treatment. Thank you.
Nice, very nice. Thank you so much for this exposure. So Mom Dental won the third place this last year on the EFP Digital Innovation Award. Zanina, is this app is not available yet, right?
No, it's not available at this moment. It's going to be available actually in a few months. At this moment, we're still working, as I said, on this map segment, because this is quite a lot of data to be included. And the second component that still is worked on is this AI segment of recognition of the symptoms. It requires really a lot of data to learn the AI how to recognize the symptoms. So we're still developing it, and we will have the first version available very soon.
Okay, and for the idea of this app, can you tell us a little bit more how your personal experience, you know, as a mother and also a periodontist, led to the creation of the Mom Dental?
So it's very interesting. Really, I thought about this app for years because I had a lot of patients that had very advanced symptoms of periodontal disease during the pregnancy. And at that stage, really the AI wasn't developed. The artificial intelligence wasn't giving me the ability to develop this app in that way. But last year, when I saw the call, I was pregnant actually with my second child. And I thought that was a perfect moment to really finish this application and submit for the Digital Innovation Award, because I had a direct view of how to be a pregnant woman, to be a periodontist, and also to be someone to design this kind of application.
Very nice. And just for our viewers really have a view of this app, how it's going to work. Can you describe a little bit the user journey? Like, for instance, what happens from the moment that the patient takes a photo until they receive a personalized recommendation? How exactly that works?
The app is, the use is going to be very simple. So they're supposed to upload or take a photograph directly in the app of their gum from the frontal view. Of course, there are going to be some recommendations on how to make a better photograph and which one is going to be the best. All the data are going to go, of course, to the base of our program with that contains thousands of analyzed photographs with already recognized symptoms of gingivitis and periodontitis. And in that stage, really, the AI is working its job. It's going to do the personalized analysis and send back the report to the user in the form of a document with current status of their health. Of course, we are going to have even an index of how good the health is at that stage to make it simple for the users. But of course, more detailed informations are going to be in the report for patients to send them to their periodontists and to have a nice tracking of the symptoms.
And this report is just generated by AI, right?
Yes, by the AI that is learning still at this moment to recognize correctly all of those symptoms and really exchange a periodontist at first view, very simple tracking of the symptoms that, of course, is going to help women lead to their periodontist and have a treatment as soon as possible.
And how it was for you to merge in this world of AI being a periodontist?
It was really, really interesting because really being a dentist and a periodontist, we don't really work at this segment. So this was very new for me. And understanding some of the points and stages of development is still something that I'm learning and working on. It was very abstract at the beginning, but it is also important to have a nice idea from the beginning to know how to develop it. And later on, the technology really is helping. At this stage, we have a very good use of course, my collaborators are working on this segment, but I learned a lot, and this is a great view to really use some other knowledges and develop even yourself through this kind of word contest.
Very nice. Yes, and Andreas.
Bruno, I think this is an important information for the colleagues that potentially consider to apply, because as we see here, the app is not ready. So you do not necessarily win because you have a product that is up and running, or is not a prerequisite, let's say, to win that you have a product that is running. What is important is that you have an innovative idea, a clear plan, clear description so the jury can understand, but also a clear business plan. This is really important.
Absolutely. That's really a nice point for our future participants for this award. The award, the innovation doesn't need really to be in the market. It can just be the project, but of course the project needs to have a very nice structure for, of course, our panel of experts be able to analyze it properly.
And exactly, and the business plan, really the business plan is very important.
Very nice, Zarina. Thank you so much for this innovation. I am looking forward to test it in a few months, hopefully. And now we are going to pass for our next winner of last year. It's actually our the first prize of last year by Daniel Palkovics. Daniel is graduated from Semmelweis University in Budapest, Hungary. And after his graduation, he started his residency in the same university in the Department of Periodontology. His research work focused mainly on radiographic image processing, artificial intelligence, CAD, 3D printing, and their clinical use in periodontology and reconstructive surgery. His project for this award was the 3D Periodontist Innovation, to close the gap by providing a digital treatment planning software for comprehensive periodontal rehabilitation and, of course, to improve patient outcomes. Daniel, please tell us more about this innovation that you developed.
Thank you very much. It is a pleasure to be here, and thank you for the EFP for inviting me to this meeting. And you have explained it so well that I barely have to do any talking now. But 3D Periodontist is an application under development, which, as you said, supports periodontal treatment planning through 3D visualization of periodontal tissues. And not just the bone, the alveolar bone, but also the gingiva and the teeth, realistically, how they resemble the real life scenario. Can we please go to the next slide? So the application combines CBCT scans and intraoral scans, but the biggest part in the application is the AI-based CBCT processing, which automatically produces a highly detailed 3D image of the CBCT scan, which has a 92% accuracy compared to manual segmentation. Manual segmentation is a very lengthy process, which isn't really feasible for practitioners to do, but artificial intelligence has developed very far, and now it's very easy to produce 3D models of CT scans. And previously, there were no really AI models that focused specifically on periodontal patients because, as we all know, CBCT scans is not a routine diagnostic modality in periodontology. But this way, I think we can increase the value of CT scans in periodontal diagnostics. If we can skip to the next slide, please. So this is just an animation that shows how CBCT segmentation works. In reality, this is not as visual. It's just basically the beach ball running around on the computer screen, and then magically the 3D model appears. But the DentAI application that the 3D periodontist is really a module of allows to, if the AI did any sort of mistakes, it allows the users to manually correct them. Can we go further? And 3D periodontist really has 4 major functions. The first function is a 3D periodontal chart, which combined with clinical probing measurements, we can visualize the pockets on the 3D models of CBCT scans. So this way we can simultaneously look at radiographic data and clinical data, and simultaneously see the pocket depths and also the bone loss. It also categorizes the pockets based on CPITN index. So if it based on pocket depth, it can either be green, yellow, or red. It will also provide an automatic single tooth prognosis assessment based on the geometrical properties of teeth and bone and how these two relate on the 3D models. Based on clinical guidelines, it can be just based on the bone loss, prognosis can be automatically provided. Of course, the dentist will have an option to modify that by adding multiple factors like tooth mobility and so on. The third function will be a virtual surgical treatment planning module, which is sort of like a free-form CAD modeling, but this way we really can simulate the flap preparation and the access to intrabony periodontal defects digitally. So simulate flap elevation, then simulate the regenerative materials that we want to use. And this way, really, we can reduce surgical trauma and do a very defect-specific or patient-specific surgical treatment. And the fourth module is not really geared towards clinicians, but it's more like a research purpose. We can evaluate the changes in 3 dimensions by superimposing CBCT scans taken in different time points, that we can evaluate the changes that occurred after regenerative surgery. We can evaluate the probing pocket depth changes, and we can evaluate the hard tissue fill of intrabony periodontal defects. The application is currently under development. Some of the functions are already functioning, but some of them are still currently developed. Our company, which is a spin-off of Semmelweis University, it's called Dent AI, and currently we are in the process of medical device regulation, which is a very lengthy process. So the application will be available once we acquire the CE certification, which can take somewhere between 1 and 1.5 years. So until then, unfortunately, for the wide public, we cannot really make it available, but maybe trial versions we can make available. So, and I'm really looking forward to that. And thank you very much for having me.
Thank you so much, Daniel, for this fantastic software. That's for sure. One of my first questions is, of course, when, but you already answered that question. But tell me something. What was the specific challenges in this type of approach that inspired you to develop this 3D periodontist software?
So I consider myself a beginning dentist. I'm doing this for 8 years now, and I had a many times challenge that when I opened the flap, the intrabony defects did not really look as I imagined them based on intraoral radiographs. And one time my supervisor asked me that could I somehow do a 3D model of a specific patient for a specific surgery. And at the time, I was, for some reason, considered the IT guy at the clinic, and I had no clue how to do it. And I started to look online, and these questions from my supervisor combined with my struggles in the clinical practice drove me to this point where I figured out also for myself and also based on YouTube videos how to segment CT scans. Then I did manual segmentation for a long time, which was very lengthy. Nobody else wanted to do it, but I felt like it's a very useful technology to have. And in order to make it available for everyday clinicians, we had to figure out a method for automatization. So that's where artificial intelligence came into picture.
So basically the AI participates in this software, especially in the automatization, but also on the advices in terms of flap designs and so on, right?
Not yet. So the AI doesn't do any suggestions, only image processing and 3D modeling. Well, alignment of CT scans and intraoral scans, and also only in the model acquisition part. Yes.
But the purpose is for the future AI also can do a sort of a proposition in terms of which kind of treatment, which kind of flap, which kind of biomaterials we should use.
Absolutely. So I think that's even possible today if we properly train even ChatGPT. And there's an available method where you can train your own ChatGPT on a structured database. So it's not sort of contaminated with a lot of information on the internet, which aren't 100% reliable. And I think we can incorporate something like that that would suggest the evidence-based solution for different clinical scenarios.
And in terms of the future, I know that it's maybe a difficult question for you now. How do you envision for the 3D periodontist to evolve, to handle the emerging periodontal treatments that will come, the new guidelines, or even to see how could you use the 3D periodontist eventually, even the type of software for other areas of dentistry?
So our software, Dent AI 3D Guide is currently planned as a comprehensive treatment tool for the entirety of periodontal rehabilitation. So not just periodontal treatment planning, but also alveolar ridge reconstruction and eventually implant placement. So it will offer multiple modules for multiple surgical procedures. Also, as for 3D periodontist, I was really thinking, because the most times I get this question, why do we take CT scans of periodontal patients? And this is due to the excess radiation dose. They have these safety concerns. And I was thinking of some methods, how we can produce a 3D model of basic patient data without a CT scan. And I think we came up with a solution for that. And we have prepared a manuscript together with Christoph Ramsayer from the University of Bern, where we used basic patient data just to sort of get an approximation of the 3D topography of the bone. I think that would be the tool that most dentists for the most periodontal cases could use, because really CBCT is there for the most severe cases, maybe stage 4, where taking a CBCT is also justified by the need of other surgical treatments. But for not as advanced cases, probably some approximation and 3D assessment of the periodontal bone topography without a CT scan could be sufficient as well.
That's perfect. So there is still a lot of space to innovate for sure on that software, but looks quite impressive. And I look forward for you guys to have the CE accreditation for us to be able to test it. That's for sure.
Thank you very much.
Guys, so I think we are in the end of our session. I will pass the word now to Andreas.
Thanks, Bruno. Thanks, Daniel and Serena, for your nice presentations. I think it showed that this award has a big variation of topics and very high level. It is indeed, last year we had very many applications of very high quality. It's impressive that a dentist can create this type of projects and put together the energy and, of course, the knowledge and the group that builds this project. I'm really impressed. I could never have done something like that. Having said that, I don't think that anybody that is interested in working in this field and has ideas should be keeping themselves back and not apply. They should apply. And even if the project, as we said, is not completely done and up and running and is a product, I think there are very good chances, if the idea is clear and is smart and the description is good and the business plan is good, I think there are very good chances that you can win. And I'm sure that the monetary price of this award is not big, but I'm sure that big players of the industry are attuned, maybe also today, and watch. And from this stage you can go to a next level. So please, anybody that is interested, has a good idea, please apply. And for more information, I think that you have that, Bruno, how one should do.
I was going to say, of course, this is also a very nice visibility for the project. So it's always nice to participate and have their try. So for all of you, I want to thank you all for joining us today. I hope this session has offered you a clear glimpse into the innovative projects that are recognized by this EFP Digital Innovation Award. The Digital Innovation Award is supported by Halion and is awarded every year and recognizes digital innovations that will contribute to gum health worldwide. The candidates should send their application with all the supporting materials by email in a PDF format to until the March 21st of this year, and you can check all the information at efp.org. Of course, I want to also do a special thanks to our presenters for sharing their expertise, to Andreas to give us all the information that we need to apply for this award this year, and of course to everyone that just joined us on this live session. So until next time, take care and don't forget, keep innovating. Thank you so much.